know you said to write it on the actual paper, but I didn't want to mess anything up, so I just wrote
That's
it on
okay.
like my own note.
That's okay.
Okay. So what I wrote, currently clinicians primarily rely on visual inspection and their judgment to assess skin rashes, such as those seen in dermatomyositis. Tools like
Mhm.
dermoscopy and photography are used for diagnosis, but they struggle to track changes consistently over time. These methods can produce varying results depending on the clinician, leading to irregularities in monitoring disease progression. Some
Mhm.
automated tools exist, but they're not widely used since they require large, diverse data sets, which are difficult to obtain. Clinical assessments are largely based on subjective judgment, which is essential but not ideal for large-scale data collection or for accurately tracking small changes in the progression of the disease. And the questions I thought of for the paragraph was what existing tools are available and what are their limitations? Why is there a need for more reliable methods for skin tracking? How does the automated method compare to traditional assessments?
Okay. So this is a good draft, and my question now to you is, which paragraph is this going to go to?
This was the second para, the one about like what methods are
Current
currently
state.
being used.
Current state.
Yes.
So, what do you think is the main problem that we are tackling?
I think the main problem is just that the methods being used now are just
Mhm.
it's subjective.
Okay.
You know,
So
like
when you say
I
subjective, right?
Mhm.
So is it that so when you say subjective variability, right? You have kind of addressed it, but it needs to be very clear that the same image, two physicians can have different interpretation,
Okay.
right? So to avoid that, they have developed tools, and you need to figure out what those tools are. It
Mhm.
could be there's something called CDASI, and that's a scoring system based on the physician's assessment of rash.
Mhm.
So you need to look at, hey, to address this subjectivity, they would have come up with certain tools and need not be like imaging, right? You need
Mhm.
to say like, hey, you're a physician, you look at the thing and you need to have something consistent. So what is the questionnaire, or what is the tool that they're using? So that needs to be mentioned over here.
Okay.
Okay, so I mean, this is like a good draft when it comes to like outline, but
Mhm.
the expectation would be, hey, you need to go back and read with respect to what those questionnaires are and what that assessment really looks like for dermatomyositis. So the search keyword that I would look for is, what tools are available to quantify skin rash in dermatomyositis? Right?
Okay.
I'm pretty sure you did that in one variation, but it should not be limited to imaging,
Yeah.
right? So it could be
Mhm.
any questionnaire like, hey, let's say I want to assess depression in someone, right? I have a questionnaire for that. That is an objective tool, but still there is an subjective assessment of that to a certain degree,
Mhm.
right? But if you look at
Yeah.
the depression or anxiety questionnaire, they have removed anything that the physician has to do, right? They have put
Mhm.
it to the patient and they're saying that, hey, you need to rate by yourself. So you tell me, in a tool like that, what would the issue be?
In the
Let's take anxiety, for
in
example, right? So for anxiety,
yeah.
you have a questionnaire, and
Mhm.
I am a physician. I'll give you the anxiety questionnaire, and I'll get a number, right? Based on
Mhm.
that, I'll make a decision saying that, okay, do you have anxiety or not, right? So can you tell me what are the issues with having such a tool, like a questionnaire? What is the issue with having such a
Mhm.
questionnaire?
You're getting the information like straight from the patient, which does has positives, but at the same time, like, you know, sometimes they may not answer the questions truthfully, sometimes it may not
Mhm.
be fully accurate.
Mm-hmm.
Because it's also like, even with the patients, it's also like subjective, if that makes sense.
Correct. So there is an amount of variability that comes with the questionnaire, right? When you're saying like a questionnaire, and each person's perception of that question might be a little bit different. See, when I say different, it's not going to be 0 and 4. It's going to be 4 and 3. Right, so that is the research gap that you're trying to address by bringing in a more, objective tool of assessment. Okay, so if I say, let's say a patient came presented to me with ADHD. Do you know what ADHD is?
Yeah.
Attention. I mean, people keep fidgeting, they keep switching from
Mhm.
one task to another. Sounds like us, but they have a real issue. But anyways, so ADHD, let's say on day one, you come, I give you the questionnaire, and then you answer set of questions, right? Let's say then I give you this drug called Adderall. Next, after a month, you come back to me and then it's not changing. The
Mhm.
questionnaire, I'm seeing the same result. So what does that mean?
The Adderall isn't helping.
H- Now, Adderall, do you think there is a big black market for Adderall? There is.
Yeah.
What if I'm coming to you and taking prescription for myself and selling it to someone else? How do I verify? Can I use a questionnaire?
Mm, maybe.
How?
It,
Tell me how.
it's like you're prescribing Adderall for ADHD. You from the questionnaire saying these are like my symptoms are this and this. This is
Mm-hmm.
how much I fidget. This is how much I can't focus. Just stuff like that.
Correct.
The
Yes.
Adderall is supposed to help with that, but then
Mm-hmm.
you come back, you answer the same questions, but you don't see any difference with what when they're supposed to be using the Adderall. So if there's
Yes.
no difference when they're supposed to be, they could be like, oh, maybe they aren't taking the Adderall, maybe they're selling it.
Okay. So how can I make that acquisition? Maybe the Adderall dose is not sufficient for my patient.
Mm, I
Imagine
mean,
you're a physician and that's the first accusation you make. Will he
are you
be fine
selling?
with you? No,
No,
right?
I'd be so upset.
Yes. So in that case, is a questionnaire good enough? No.
No.
So you need to have a test that will look at the Adderall levels in my body.
Mm,
Like when I take a urine test, that time I have some Adderall residue. So in that case, I will know has this patient been taking Adderall or not. If I want to cheat that test, you know what I should do? The last 3 days before I go to the visit, take Adderall, right? And then your
yeah.
levels go up. Again, see
But
that if they are motivated to cheat,
yeah.
you can cheat.
I mean,
Now,
you don't have to, if you just don't tell them that you're gonna have them do the test that day. If you tell them day of, chance to
yeah.
cheat.
And then see that's the issue that we always face with respect to if you know the system well enough, you know what the loopholes are. Right? Now, I'm not teaching you the loopholes. I'm trying to say that, hey, these are the gaps that exist. Now, how do I
Yeah.
address that? Let's say I have a way where I can monitor your drug levels every day. Then can you cheat that? Most likely not,
Yeah.
right? So see, there is a use case for any research, and the gap that you're trying to address should be very clear. Make sense? So if we had to, for the sake of work today, if you were to address the gap and say in Adderall questionnaire, how would you write the second paragraph for the Adderall questionnaire?
Mm, probably talk about,
ADHD questionnaire. Mhm.
yeah, I mean, I would probably talk about like how Adderall is used now, but also mention how Adderall can, is like
Can you write
There's like
those?
a big
Can you just write
oh
those points in point wise on your sheet, the doc that you've
mm,
opened?
yeah, probably like
Hmm.
mention uses, like current uses of Adderall.
See, I asked second paragraph. So think properly
No.
about what the second paragraph is supposed to do. So what's our problem statement? Let's start with that. Let's start with our problem statement for the Adderall example.
Mm, that it's hard to it's hard
Tackle
to just
abuse of Adderall,
I put Adderall there.
right? So that's our problem statement.
Mm-hmm.
So given that problem statement, your first para, what would it be, right? The prevalence of abuse with respect to Adderall, the types of
Yeah.
abuse that happens, and then you kind of talk about the, black market for Adderall, right? And you put in the numbers from each agency that you get. Make sense?
Mm-hmm.
That's your first paragraph. The second paragraph would be in your first paragraph, you'll also, in the second paragraph, you want to address the how Adderall is being prescribed and how physicians are facing issues with, you know, so basically your second paragraph is the current tools physician have to make sure that the patient is taking Adderall and not selling
Mm-hmm.
it. So prescription of Adderall will go to the first paragraph, but mainly you
Oh,
want
okay.
to say talk about the tools that they have.
Mm,
Exactly. So here you would talk about urine test. Number one, you'll start off with questionnaire, then you'll start talk about urine test, then you will talk about how frequently these are used, right? And then, yep. Then you'll describe, this is where you'll describe about questionnaire as well as the urine test or any other test that they are doing. It could be, see, start off with the easiest, right? That is the questionnaire. Second easiest is the urine test.
mm-hmm.
Third is drawing blood. Fourth could be doing a more invasive test.
Mm-hmm.
This is the current state, and this should go in flow, right? So first is easy, second is easy, first is easiest, second is easy, third is harder, fourth is hardest. That should be the flow for the current, technology or current use case. Now, given that, now go back to the paragraph that you have written. Can you make the bullet points like this that I gave you, for example? Tell me the problem statement here. Start with that.
Um, problem statement. Um, identifying skin rashes
Hmm.
in dermatomyositis.
Okay.
Yeah, that's all.
Identifying skin rash. So it's okay, just put like points. You don't need to write
Okay.
the whole thing. Yeah, now what would your second para be?
First, I would describe the current tools being used.
Mm-hmm.
Um, you have so yeah, dermoscope,
Correct. That's your tool. Mm-hmm.
photography, visual inspection.
Mm-hmm.
Is there any more
What else do you think they could be? A questionnaire?
about the rash?
Yeah.
How red is your
CDASI is a
rash?
questionnaire. Yeah.
How much is your rash itch? How long have you had it? Yeah.
Yeah.
Mm,
And there is also called quality of life questionnaire.
oh,
When you
okay.
have a rash, your quality of life decreases, and then based on that, you can track objectively, is the patient getting better or not.
Mhm.
Same thing with vitiligo. They'll assess your quality of life based on the thing. They have something called, what is that? Some dermatologists mainly use this questionnaires. So that's the thing. Next, what else would you think of over here?
Okay. Um, after they would describe the tools and the uses, and
Mhm.
then the limitations.
See, limitation doesn't come over here, right? You have to describe
Mhm.
mainly what the tools are available, like the current
Then,
state. Right? Now, if you want to keep it to three paragraphs, yes, then you describe the limitation in the second paragraph.
mhm,
Ideally, it should be four paragraphs.
mhm,
Make sense? So your fourth paragraph would be the limitations with the existing tools. Make sense?
mhm.
So the now, how I would want to change it is we will do so today we'll work on the that and the third paragraph because we missed a few classes, and we will I'll start presenting now so we'll have a better idea. I want the entire screen. Yeah, let's do loading. Yeah. So this is a presentation that we made. We had a potential philanthropic person who wanted to donate to the department for research of
Mhm.
myositis. So we wanted to go over the projects that we are doing at our center. And I did not know. So apparently University of Pittsburgh was the center that got FDA approval for infusion that is used in myositis. And
Mhm.
based on, so that's the main study that everyone uses to give IVIG infusions for myositis. Like
Okay.
anyway, some sort of infusions.
Mhm.
So this is our, project, right? Quantifying dermatomyositis skin rash. This is a novel image-based approach. Now, if you in this presentation, what would you push back on when it comes to the title, given you know the context of the
Mm,
project?
Quantifying capacity schema phase complex. Mm,
Think about the
I'm
title. And in your second paragraph, you kind of alluded to detect identifying the rash.
mhm,
And what is the title telling?
quantifying.
So in quantifying, you're not identifying the rash,
Mhm.
right? So see,
Yeah.
words make a lot of difference, right? So we need to really think about it. So what what would the difference be between the way you perceived it versus how this paper is perceiving the method?
Um, Wait, so quantifying is like the
You know that
is
the
how
rash
much
is
of the rash is there.
dermatomyositis. Yes. See,
Okay.
when you say quantification of the rash, right, you know that there is a rash. When you
Mhm.
then the second thing is if you say identification of the rash, you don't know if there is a rash or not. You have to first identify, then you have to
Mhm.
quantify, right? So what we are skipping the fact that identification part is being skipped. Now, why did we take that
Mhm.
decision? Was because as a clinician, you know if there's going to be a DM rash or not, right? In most cases.
Mhm.
So our tool is going to make your life easier by replacing all the questionnaires and, hassle of you keeping track of the questionnaires. Make sense? Instead of that, you'll have like a automated skin-based, objective approach. So basically, I'll run over what dermatomyositis is. It's a rare autoimmune condition which has multiple presentation. You can have myositis. Myositis means muscle, so it's damaging your muscle. It's also has
Mhm.
the potential to damage things that are not your muscle, like any autoimmune disease will most likely damage your bone. In this case, it's damaging your skin, and the presentation of the skin damage is basically in the form of a rash. So
Okay.
essentially, what I'm trying to say is your dermatomyositis can, in most cases, have skin presentation. There will be some cases where skin presentation might not occur, but if there is skin presentation, the severity of the disease is based on the severity of the rash,
Mhm.
right? In dermatomyositis. Now, what is the unmet need that is out there, right? One is diagnostic is a challenge. Then there is obviously a lot of variability in clinical assessment. In most cases, even the experts disagree. So the role for an expert you know, is really required in diagnosing dermatomyositis. So the solution that we came up with was having a tool that will assist your non-experts in making accurate disease progression and also having an objective assessment for clinical trials because that's where it's more important. And the ideal use case is going to be facilitation of telemedicine, where the physician would not be able to objectively quantify the rash based on, video conferencing tools. So that's the thing. And this is also engaging for the patients. So the outline of our project is basically image acquisition. This is standard, anyone can do it. The difficult part is the image analysis. Either you have an expert who's doing it or a non-expert. The challenge that we faced was non-experts might have more variability when it comes to experts. So we want to take all the images that are labeled. When we say labeled, it's basically, hey, this is dermatomyositis, as well as this is the area that the rash is covering. And then we are going to pass it to a machine learning algorithm, and that it's supposed to learn what a DM rash is supposed to look like, and then come out with a output saying that, hey, this is how the rash is progressing, right?
Mhm.
That's the goal of this project. Then for image acquisition, we are trying to give it both 3D and 2D images. For 3D images, we are using a very expensive tool that is capturing the whole area of the skin. And you can see the first image is the 3D image, and the second one is an image that is taken through a smartphone. And we have two visits. First visit in day 0, and second visit is on day 30. So first is a clinic visit, third is a televisit, right? Now, when it comes to trying to work with any models, the best dermatomyositis data set that's out there has 67 images. And these are not specific to hand, eyes, no. Overall, it could be from the same person as well. Hand, eye, everything combined, it's 67 images. That's the
Mhm.
state of data set that we have. So it's very challenging. We have to create the data set by ourselves. So we are collaborating with multiple sites, ideally Stanford, Mayo Clinic, so that they'll provide us with their patients. So when it comes to the image analysis end, so this has like mainly three parts. Before you pass on your image to the computer, you need to make it easier for the computer to understand. That step is called pre-processing. And once you have done the pre-processing, you want to extract the features of the image. It could be texture, it could be color, it could be, any other features of the image. These features are already well defined, but among all these features, for our disease, we chose redness to be the feature of our interest, right? Based on these features, all these features, we are going to train our model and we are going to compare it with the expert evaluation of the rash. When we say expert evaluation, basically give the expert the image, make them evaluate and draw what the area of the rash is going to be, and also verify with the questionnaire scores. It could be CDASI and skin quality of life scores. So this is what we have compared area, and we want to see if the area of redness will make increase, will make the patient have a worse quality of life, right? So when we say how are we calculating the area of redness, we are basing it on the percentage of surface area between the normal hand versus the area of the rash in the same hand. So what are the future steps for this project? We basically want more enrollment, and we want to, in an ideal scenario, have enough images where the model will be able to start diagnosing dermatomyositis out of other conditions, right? And the diseases which have similar rash presentation to dermatomyositis is lupus, psoriasis, lichen planus, seborrheic dermatitis, rosacea is acne, and actinic keratosis, drug reactions. But the most common among all these are drug reactions. So at least if the model is able to differentiate between a drug reaction and versus dermatomyositis, that would be a big achievement for us. So so this is the end. This was the end of the presentation. This is like going over with respect to if you want to have like a diagnostic model, you need to train the model to learn about all the data sets in this case, right? The best data set you're gonna get is psoriasis, the best data set. If you say like, the most accurate data set is melanoma data set, that is skin cancer, that has 30,000 images. And imagine 30,000 images and where are 67 images, right?
Yeah.
Very different. So obviously the model is going to require much more, refining, and we need a bigger data set. So the simple way is, in this case report, we are not only talking about quantification, we are proposing a method for image segmentation, right? Image segmentation involves removing the background, number one. Number two is first is pre-processing the image. In the segmentation method, we are removing the background, and we are also trying to have like k-means where we are trying to chop the image into different features. The feature of our interest was redness. Based on the redness, we are choosing, that area. That is the segmentation method that we have used. Post that segmentation method, we want to again bring it back to the original image, having highlighted the area of the rash.
Mhm.
That will become your segmented image.
Yeah.
Make sense? So this, I would say, this general process is a very important slide, and it will really help you in building the methodology for our paper, right?
Okay.
So in our current method, you can take a look. So again, see, this is not our patient data set. This is a public data set. It's recorded by Pitt. So telling it again,
Yeah.
this was in public domain. You look at this. This is the pre-processing stage. I have converted the RGB red, blue, green image to a LAB format. Lightness, B and A. B is for yellow and green. A is for redness. So in that format, the computer is better able to differentiate between the redness. Make
Mhm.
sense? And from that, I've used a deep learning model to identify the image and remove the background. Okay.
Mm.
The reason why I want the background removed is our feature was redness. If I have a red book over here, right, and I'm not able to remove that red book, my area of rash is going to be messed up. Make sense? I'll show you the, image as well. Next, we have now you can see that the UNet model has successfully removed the background, right? And based on the redness, whichever part had the highest redness in the skin, it is able to identify that. Makes sense?
Yeah.
And this is pretty good, right? So, in what condition? Now, the second question would be, what conditions? I want you to write this down. What
Okay.
conditions will this method work? Okay. So if you can answer this to me, so where will this go? The question that I asked, it's a very important question, correct?
Mm-hmm.
Where do you think it should go? In which section of our paper should it go?
Mm, the the third pair? Or would
Hmm.
it,
The whole paper. Don't think only about the introduction.
oh, um, yeah, let me pull up the other paper just like
Hmm.
uh we have abstract. Probably I would think say methodology, maybe like the
Hmm.
data collection section because this is how you're collecting the data and
Yes,
you can't collect the data without explaining how you collect like you can
correct.
collect the data, but like if you don't explain how you collected it, it doesn't it's kind of pointless.
Yes. So in your method section, you are precisely describing the conditions that you want them to collect the data in, right?
Okay.
That's absolutely right. And also it goes in the discussion section,
Okay.
right? In discussion section, you're really talking about why you have to do it a certain way, right? You're discussing about what happens if you don't do it a certain way. What did I
Hmm.
bring to this slide? I told that if you keep a red book, right? It's going to identify that as the area of the rash, right?
Hmm.
So I said you should not be getting a red book.
Yeah.
So I will show that to you. Yes, this is the output if you get a red book.
Oh, okay. It just looks at the red book.
See, your deep learning model did something very useful. It removed all the background, whatever it
Hmm.
thought was the background, right?
Yeah.
So, but it since the book was a highlight, for some reason the book stayed. We don't know why it stayed,
Hmm.
right? So if the book stayed, that is red. That's it. End of story. Make
Yeah.
sense? So now now you think about, the approach that we took, right? I I'll go back to this slide. Think in our method, we have to have pre-processing. Write this down. Second one, you are going to have segmentation.
Okay.
Third one, you're going to have post-processing.
Okay.
So for pre-processing, we basically try to just change the format of the image. It could be saying that, hey, you need to take only JPEG or PNG format, right? And you need to convert it to LAB format. In pre-processing, the image was converted to LAB. When we put it back, right, we have to change it back to RGB. correct? In a format that's
Mhm.
easier for us to see. So that is the post-processing part as well. So coming to pre-processing, you have to put it in a certain format, you have to put it in certain dimensions as well to get the ideal experience, right?
Mhm.
And when it comes to segmentation, right? When I did k-means, it's not something that I chose out of the blue. Someone would have done it, right? So in the
Yeah.
when I what I wanted in what I really want in the current technology paragraph is k-means people are doing from a very long time, right? In k-means, all that is trying to say is, hey, when you have this image, you will get certain air, certain pixel values, right?
Mhm.
Those pixel values, I'm going to be able to segment it. That's it. K-means is a segmentation tool,
Okay.
and it can segment blue also, it can segment red also, it can segment yellow also.
Mhm.
So what did we choose? We asked K-means to segment only the A region of the LAB,
Yeah.
right? So that should be mentioned.
Okay.
Now, if this is already out there, what are we adding to the science
Mm, specifications,
with respect to?
dermatomyositis, rashes.
Mhm. Okay. Can you share your screen about your second para?
Yeah. Okay.
So now, given my presentation, what else would you add in your second para?
Um, I would probably um describe the actual tools a bit more because I mentioned them, but if
Hmm.
someone were to read this, they won't know what a dermoscopy is.
Yes.
Um, maybe mention I would mention more tools
Okay.
and then just how they are how they're used, like not just what they are, but what they do
Hmm.
in um in relation to like diagnosing or not
Okay.
diagnosing, like quantifying the rashes.
Yes. So first thing is we have to focus on quantification, right?
Hmm.
So
Yeah.
what will our goal be? You have to change our vision from identifying skin rash to quantifying skin rash.
Hmm. Yeah.
Then you become more precise. You look for tools that clinicians are using for quantification of skin rash,
Hmm.
right? Then what are the proxies for skin rash quantification, like the quality of life questionnaire, CDA-C score?
Hmm.
These are proxies that are giving you the same output, right? So talk about the main tool as well as proxies.
Okay.
Okay. Next, once you focus on the proxies, now you need to talk about the segmentation method,
Yeah.
right?
Hmm.
This comes in the second para. Can you tell me why it comes in the second para?
Mm, because you're talking about the implementation of the tools.
Yes. See, multiple tools can exist, right? We, if they have not integrated everything, that's not our fault,
Mhm.
right? So we need to say that, hey, these tools exist and people have done it. It's
Mhm.
just that they might have not been able to remove the background a certain way, right? And
Mhm.
they might want it to be like a more, simpler background, white background, for example, or no background, for example, right? So that is something, that is a limitation that they might have not addressed. Make
Yeah.
sense? So there will be like, certain tools that already exist. When you say
Mhm.
skin rash quantification, you have to mention the segmentation method that is k-means over here because we didn't
Okay.
invent k-means.
Mhm.
Make sense? So
Yeah.
that also goes in your second para.
Mhm.
Sounds good? Then what
Yeah.
else do you think in our process could go in the second para?
Um, mm, I don't know how I can think of.
Mhm. That's okay.
Yeah.
You're doing really good, by the way. It's very technical. My rheumatologist gave up.
Oh.
She gave up. Anyway, so I'll go back to sharing the screen. But did it make sense?
Yeah.
Once I explained, I hope it made sense.
No, yeah,
See,
it all
if
makes
it's
sense.
going a little bit over the head, please let me know.
Okay, yeah, but
Okay.
I get it now.
It's very, very important that I know. So, yes, this is there. Uh, I made a checklist of things that we had to discuss today so that I don't miss anything. So, we did PPT of the project. Then I need to show you a demo of a case report. And
Okay.
we went over your work as well as, like the para that we had to write. So, this is the para that we have to edit, right?
Okay.
So can you tell me why the 67 images make sense in the second para?
Mm, because the 67 images are about Dermanet, which is like currently being used,
Mm-hmm.
and it's kind of bringing up a limitation because it's saying only 67 images, which isn't really a lot.
Mm-hmm. How would you
So,
change that sentence?
however, existing data sets such as Dermanet with only 67 images are. Mm,
Does that sound
uh,
better?
what is it? All the available models are trained on the same. Yeah, I think it gives it like more context.
Yes. And does it still fall under the current technology
Mm-hmm.
or
Because you're still
current
talking about
technique?
Dermanet, but now you're adding like that its use.
Yes. So if you think about, the overview, right? The second para is trying to achieve. Focus on the available techniques,
Mm-hmm.
available things that people are using. One is the Dermanet. Then, when it comes to the segmentation technique is through k-means,
Yeah.
right? Which is recommended for skin rash. Okay, see, here we are not poking holes into what's available, right? Next, when it comes to third para, right? What are we trying to focus in the third paragraph? Limitations,
Yeah.
right? So my main limitation would be Dermanet, 67 images, have only 12 images per hand. Okay. And in that, it's not good enough. It's really not good enough, right? The second limitation would be K means we don't know what is the number to choose for segmentation. Basically, how many slices do you want to chop the redness into, right? Because there is some amount of redness in every person,
Mm-hmm.
right? So how do you come up with a number for that? That is a limitation for dermatomyositis. Make sense? So that would be a
Mm-hmm.
second limitation. And the third limitation, and these would be like C, but main limitation would be like talking about how the questionnaires are variable, they're subjective, and they are time consuming
Mm-hmm.
variable. Make sense?
Yeah.
That's the goal for the third paragraph, right? So your fourth paragraph would be, what are we trying to do? It's a semi-automated method where we are for detection and quantification. So if I only speak about quantification, it's an automated method,
Yeah.
right? If I want to, I want the physician to still detect the disease and then quantify the disease.
Mhm.
Use this for quantifying the disease. Now, does it make sense?
Yeah.
The introduction.
Mhm.
Okay, so this is about the technique, right? How do we say how do we take a use case for this? Someone has to do it, right? At some region, some place you need to do it. So the use case is basically the case report. Why we picked a case report? Because we don't need IRB approval. That's the only reason I chose case report, nothing else.
Mhm.
I would be happy if they would have given me like the labeled data set for all the 100 cases that we have, but in the, assessment of time, we don't have it. So
Yeah.
anyway, this is how they write case reports. Okay. So in a case report, what would be the focus of the case report? Read the title over here.
A rare form of dermatomyositis with associated with muscle weakness and normal creatine kinase level.
Creatinine kinase levels. So what do
Mhm.
you, from this title, what did you understand?
Um, and the case report's going to be about like a rare form of dermatomyositis with like other effects on muscle
Mhm.
weakness and the creatine levels.
Okay. So when they say normal creatine levels, right, that is something you need to focus on. So the
Okay.
assumption with the title is it should give you everything about the condition
Hmm.
or whatever they're trying to speak about. So even if I don't know anything about dermatomyositis, I will say that when they say normal in the title, and if they say rare, it's not supposed to be there. So in most cases of dermatomyositis, in all cases, you have elevated creatinine kinase levels. But in this case, you have normal creatinine kinase levels, but you have muscle weakness.
Okay.
Okay, so that's all. That is a case report which has been published in a very good journal, right? So then you need to think about, hey, how am I going to use this for my technique, right? So how would you title our technique when you want to submit it as a case report or as a report?
How are we like quantifying dermato well, quantifying dermatomyositis using I don't know.
Hmm. Whatever our title is,
Using
just add case report of
oh,
dermatomyositis. Right? Or just add case report. That's it,
okay.
right? The minute you add case report, this you need to write. That is a case presentation. Make sense?
Mhm.
So if you were to come up with the hand data set for dermatomyositis that you want to train your model on, right? What would you do? Go to PubMed, search case reports of dermatomyositis, copy all the images that they have given over there. And you need to see how many images will you get, right? That itself is a data set,
Okay.
right? So this is something, right? So you need to think about, hey, case presentation. That's it. That's the case presentation. Basically, you need to talk about how the patient presented to you and the characteristics of the patient. And since they spoke about lab values, right? This is muscle weakness and lab values. So they have to have a section for investigations. Are we focusing on lab values?
No.
So our section, which is this, is going to be what? About the techniques.
Oh, okay.
Does that make sense?
Mm-hmm.
So basically, this is a section that we are going to have for publishing the case report. Basically, a summary of what the case is, how things work, etc. And then,
Mm-hmm.
we need to show images, like how we extracted, blah, 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 and then something like this. Make sense? So when you look at this, right, can you uh, can you tell me what you see in these two difference between visit one and visit two? Would you say
Um,
progression, no progression?
I think it I think it got worse.
Yes,
Yeah. The
yes,
second visit, it's not like the image, the rashes looks a little lighter, but you can tell like it spread more down to like the middle of the hand.
yes. It's gotten worse.
Hmm.
So we want to make sure that, you can assess it quickly and this comparison, at least it pops up easily.
Yeah.
Make sense? Now
Hmm.
imagine if in the same thing, I would have showed you like this. It would have been easier for you to compare, right?
Hmm.
Between the two.
Yeah.
That's it. That's all the code is trying to do.
Okay.
Make sense? We need to
Yeah.
communicate this in our case report. Sounds good?
Hmm.
So how are we doing so far?
Good.
Good. I will hide this. So with when it comes to our paper, what is required with the case report is not a lot because the main focus is going to be the method. So
Hmm.
I would keep the case report aspect mainly towards the skin presentation rather than anything else. I have to give lab values, but I really need to focus on the skin presentation.
Yeah.
See, in this case report, they wanted you to focus on muscle weakness and normal CK levels. I'm pretty sure in this whole case presentation, that would be their main focus.
Hmm.
See, when they say, if I want to say weakness, right, muscle weakness, I need to know that this muscle weakness is because of dermatomyositis and nothing else. How are they
Yeah.
proving that? Number one. Number two, I need to know that, okay, is this is this a flare up or not?
Hmm.
Right? Now come back to our method and our case. What are the things that we have to present in our case report?
Mm, but we have to present the methodology, like
No, no,
how
no, no.
the
Leave the methodology. Think about you have to, okay, let's read this together. So read this for me. Case presentation.
uh, a 61-year-old Vietnamese woman presented in February 2019 with a 4-month history of a violaceous erythematous rash with scaling on her arms, thighs, scalp, and face, weight loss from 45 kg down to 38 kg, associated arth arthalgias,
Arthralgia and weakness.
arthalgias and weakness resulting in falls and need for a walker to mobilize. The patient was prescribed amoxicillin with clavulanic
Clavulanic
acid
acid. Mhm.
Alvelinic acid by her general practitioner 3 weeks prior to presentation for skin infections due to persistent scratching. There was no history of any fevers, rigors, travel, or sick contacts. There was a vague history of external I don't know dyspnea,
Exertional dyspnea. Yes.
but no chest pains, palpitations, or other symptoms suggestive of cardiac
Failure.
failure.
Stop.
Um, okay.
Stop here. So I'm going to write case presentation over here.
Mhm.
And we have done with the introduction. And then I'm going to write case presentation. This is going to come after methods, right?
Yeah.
So in this case presentation, let's take this paragraph of the case presentation and then we'll put it here. And we'll say that, okay, whoever the patient is, when they visited, this is the description of the rash. Do you agree?
Mhm.
So would you say in our paper, we have to focus on describing this? That's our main focus.
Not the main focus.
This is the focus, right? Talking about the characteristic of the rash
Yeah.
and the flare up.
Mhm.
So we will have to talk about flare up and characteristics of the rash.
Okay.
And in this case report, they spoke about, in the past, she has gone to a general practitioner who has prescribed so and so. In our case, we are going to say that, oh, this patient came to us on 1 month ago. We took standard evaluation along with image, as well as we had a myositis specialist evaluate what the area of the rash is. Then 30 days after, that is today, she came back. We took another image through the smartphone, and then this is the description of the rash, day 0 versus day 30. So we have to mainly focus on the description of the rash, right? Like the features of the rash. So this violaceous is a feature, erythematous is a feature, and scaling is a feature.
Okay.
Okay. So assignment for you, DM rash features.
Okay.
Okay. Would you say that's very important for our case report?
Yeah.
Yes. Yeah. And then the so and so, blah, 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 whatever, right? So that's how we focus on the case report, right?
Okay.
See, they really focused on the fact that they had to establish that it was dermatomyositis. That's
Mhm.
very important. Next, the muscle weakness is related to dermatomyositis. So when they say, I have to relate my muscle weakness to dermatomyositis, focus on this. This is the negative history, right? I had to eliminate any fever. Number one. Next, why did I eliminate travel or sick contacts? A reason that I had to do is to, if when you travel, you might have some bugs where they bite you and you develop rash,
Mhm.
right? That is a, case scenario. Then when she had some amount of, dyspnea, when, breathlessness, exceptional dyspnea is breathlessness when she's, when she's doing brisk walks.
Mhm.
Make sense? So the question will be, is her weakness because of her heart condition, not myositis? How did they prove that? They said that she doesn't have palpitations, pains, or anything suggestive of heart failure. So in our case, we need to eliminate all other diagnoses. What are the other diagnoses? That is these. All these diagnoses we need to eliminate. Make
Okay.
sense? So
Mhm.
this is nothing but our negative history.
Okay.
Okay? This is hard even for me to write because I can write a little bit generic, but I need the rheumatologist to come
Mhm.
up with that. So
Yeah.
that's her job for the paper. Okay, when she writes, we will discuss about
Mhm.
it. Make sense? Then this is basically her past history. Okay, read this.
Um, Her medical history was significant for a 16-year history of Graves' disease requiring a thyroidectomy in 2004, uh, diverticulosis,
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 osteoarthritis, fibromyalgia with
myalgia,
chronic back pain.
and depression. There was no known history of malignancy. Her medications on admission included amoxicillin with calvin, calv,
Clavulanic acid.
calvinic acid, thyroxine, 100. This I can't read that.
Okay, leave that. Okay, some medication she's taking.
hmm One
Mhm.
tablet 3 times a day is needed. Uh, Phenylfibrate. 1 week prior to admission following it being prescribed a year ago, but never convinced. There was no stain use. She did not smoke, drink minimal alcohol, lived with her 2 daughters, and prior to onset of her illness was independent with all activities and instrumental activities of daily living.
Mhm. So here only I'm able to poke holes,
Yeah.
right? What is the hole that I can poke?
Um,
Fibromyalgia with chronic back pain, right? So they have to show me in their labs that it was not fibromyalgia.
mhm,
Make sense? So again, see, this is good. This is very well written. This is very well documented. This is how a case is going to present,
mhm.
right? So every section they add from now on is to convince me that the rash or whatever the condition was because of dermatomyositis.
Mhm.
Make sense? So on examination, her vitals were normal. She appeared severely malnourished. Oh my God, again. Is she weak because she's not eating well,
Yeah.
right?
Well, maybe.
Oh, you know what the issue is?
Are.
When you are malnourished,
Mhm.
right, you don't have enough muscles in your body, right?
Mhm.
So when you don't have enough muscles in your body, even though there is inflammation, your the levels appear normal. Does
Okay.
it make sense?
Yeah.
So how did they address that? Will be a question mark.
Mm.
Make sense?
Mhm.
So I can say that, hey, fine, you showed me a case. The reason is malnutrition, or it could be fibromyalgia that is flared up,
Mhm.
right? So again, I'm pretty sure in future they proved it somewhere. They have to have scans, blah, blah, blah. See, that is the reason why they had to have this scan. In this scan, you can check this out. See this region?
Yeah.
Right? In fibromyalgia, you don't get such, changes in the muscle,
Okay.
clearly inflammation. So it's dermatomyositis.
Okay.
Make sense?
Mhm.
So that is the burden of proof, depending on what you choose to present.
Well,
So this is how we have to write our case presentation. And this is an examination. So here our examination is mainly going to focus on the rash, right? The area of
mhm.
the rash, where it was found, blah, 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 all those things. Make sense? So
Yeah.
that is how we write the case report for it. Then when it comes to the methodology, we went over this, quite simple, right? That is going to be our methodology. Now, when this methodology becomes useful is like in medicine, it's usually black or white. We had discussed it last time. But in software engineering, you can have different tools you use in different stages, you'll get the same result.
Mhm.
So for segmentation, I told you I'm using a deep learning model, right? That's a different model.
Mhm.
So instead of that, if I use SAM, so this is a model that is developed by Meta, and they have, yes, oh, data demo. I consent. See, they have trained on 11 million images,
Wow.
the data set. Yes. So here, let's upload the same image, downloads, and you can see how this tries to segment the image.
Mhm.
Okay, close, add mask. See, it segmented the image.
Yeah. Yeah.
Right? So again, different ways to achieve the same goal. My next paper can be how I'm using SAM to segment the image.
Yeah.
Third paper can be how I'm using some other tool to segment the image. Now, what is the drawback with this? Very heavy model, very
Mm,
heavy. You need good GPUs. Takes a lot of time, right?
With
Yes.
this, it's
Sorry.
like with this one, it's not the specific use isn't for like targeting the rashes. It's kind of you can use it for anything, so I guess that could be like a limitation. It might not give us the results that we want.
So, what was the first step that we had to take? We had to segment the human body part, right? From the
Yeah.
background.
Mhm.
So either we are using the deep learning model so that is basically UNet and it removes background, or I'm using SAM to identify the human parts,
Okay.
right? Again, what you choose in pre-processing also matters,
Mhm.
right? How we are, see, it's not only pre-processing, it is processing the image. Let's call it processing, right? Before passing it to segmentation, I have to extract the human body part, right? What I use over there also is a different technique. Make sense? Now, each technique will have its pros and cons. Now, is it easy for me to tell the patient, just take it in a background in your house, right? Simple background. Don't keep like lot of objects around. You can keep it, but you should be in the main focus.
Yeah.
Is that very easy to say? Yeah,
Uh, Easy to say, but I don't
it's
know if it's easy for them to do.
easy. I mean, you can have background, but as long as you're in the focus, it's not going to be bad,
Mhm.
right? See, even in my house, there's a lot of background behind. How is it able to identify me and blur everything else,
Yeah.
right? That means technology exists where it's able to identify you as the focus. So that is a current tool that we are using to remove the human from that part.
Yeah.
Now, if I keep any teddy bear, it will segment that also. It will identify that as human, right? So that is a challenge that we face. So we have to tell them that, hey, you should be in the focus. That comes in one of the requirements of how to use our tool.
Mhm.
Make sense? So that's kind of how you go with permutation and combination and say that, hey, you can write different papers using different tools. Make
Mhm.
sense? And we have to just justify why we used what we used. That's it. Sounds good?
Yeah.
So that is how you write the, case report, and then how you introduce your technology and the method of how you are trying to do something.
Mhm.
Is this convincing enough for anyone to try it in the method that I suggested?
Yeah.
Did you get convinced? Leave anyone. Did you get convinced?
I mean, just from that, just maybe maybe it's worth a shot.
Yes,
Yeah.
it's worth a shot. Yeah, that's all we have to prove.
Mm.
Once they believe that, see, if they see all this, right? Imagine you're someone who is in the grant committee, right? Do you care about the code? You don't care, right? You care about, okay, with this code, it looks like this guy can extract the rash. It looks like it. Whatever conditions they keep, they'll keep, but looks like they can extract the rash. If I
Mhm.
give this tool to 1,000 patients, right? Will they use it to track their rash? That's it. Most likely, yes, because it's automated,
Mhm.
right? Now, if I can save the data set that is created by these 1,000 patients in the field of dermatomyositis, and they're taking one picture in every 5 days, would
Mhm.
that be a very robust data set for dermatomyositis? Yes. So I don't know if this tool is useful or not, but the fact that they're saying that they'll save the data set for future and that would be the best progression data set available, it's worth funding. Makes sense?
Mhm.
And this is the same logic that University of Pittsburgh has used from 1988,
Oh,
apparently. So any myositis case they have seen from 1988, they have saved the blood samples, the genetic material, and all the markers. Every time a new marker comes up, we can test from the blood samples and DNA material that, hey, what happened in these cases? So they have the biggest myositis database to date, which is unfunded.
oh wow.
It's
Okay.
funded by the department,
Mhm.
basically. So that is the reason why, they are better. So data has value. When people say, no, data has value. So image
Mhm.
data set is our pitch,
Mhm.
basically. What we'll do with it, we'll figure out later.
Mhm.
We are generating the data set and passing it to CMU who are supposed to be good at that. See, that's why we
Yeah.
send it to CMU. Make sense?
Mhm.
So this is how you write like case and then the report. Next stage would be method. So I think in the next class, what we will do is I don't want you to learn the method for this. It's useless for you.
Oh.
But I mainly want you to learn about how to write the section for a case report in the
Mhm.
method, right? So quick, so if you can tell me quickly, what are the things that you think is important that should go in the method section for this?
Um, so obviously first, let me open to see what's already on there. The
Mhm.
limitations, like,
We finished.
and
So
oh yeah,
introduction is over. So wait,
okay.
okay, so before I go there, can you tell me if you have any questions with the introduction section?
No, no questions about that.
No questions, right? So first para, we explain current status. Second para, current technology. Third para, limitation. Fourth para is what are we doing?
Mm.
Okay.
Yeah.
This what are we doing? You can read up. See, this fourth para keeps changing for everything. So it's just methodology, like a small description of our methodology. Make
Mhm.
sense? So that is our introduction. So when it comes to the methods, yeah, now you go ahead.
Um, yeah, like in the introduction, like I think as I go through it, I don't see um patient image.
Where? So I think no,
I'm just
that's
like,
not the one. So if you go a little
yeah.
bit higher, you will see like the case report introduction,
Mhm.
and there
Mm.
you'll see like I've
Oh
put
yeah,
some, yeah,
the case presentation.
yes. Above that, if you see this report seeks to introduce a
Oh, okay. Yeah,
semi-automated.
maybe it seems to approach objective patient. Mm, um, I don't know. I can't think of anything to add. Only,
Not anything to add. So this is the thing, right? I would say, in most cases, writing the fourth para is very easy.
mhm.
Anyone can write, right? It's
Yeah.
just stating that what you're doing, in short. So that's the thing. So this is our introduction. Now this will change in certain ways for each project, right?
Mhm.
But the core principle is going to remain the same.
Okay.
Make sense?
Mhm.
So then the main teaching from this is how we are drafting the introduction, number one, and then how we are writing methodology, right? For a case report. This is very important. Methodology for a case report is very different from others. So for that, you have to just go over like other case reports. See, this is the introduction, by the way, they have given. Very less. But honestly, that's all you need, right? For
Mhm.
what they are trying to introduce. Then case presentation, investigations, differential diagnosis, treatment, outcome, follow-up, then discussion. Discussion in this case is going to be like more robust because they had to convince me a lot of things,
Mhm.
right? With respect to, hey, why is it not this? Why is it that? And then what is the existing scenario? Blah, blah, blah. So those are the things that come into discussion. So in a case report, the most challenging part is what? Proving your title. That is the challenging part. So your main goal in your method should focus on how are you proving your title,
Mhm.
right? How are you proving the title? So in one of the classes, I told you how to write title. Do you recall? When do you write the title?
Is it, is it we declared the last? Or
Yes, yes. Now you understood why we do that? Because you
yeah.
start with methodology first,
Mhm.
right? And then you write everything else. First you have the methodology. That's what has been done. Second, you will write the result because that's when you collect the data. The
Mhm.
third, you'll write the discussion. That's when you'll do your literature review and everything. In the end, you'll write the introduction.
Okay.
Because when you did your literature review for discussion, you will have all these answers that I asked you to come up with, right? All these answers you will have.
Mhm.
Does it make sense? So that's the way you write the paper.
Mhm.
Okay. So we'll take few minutes break.
Mhm.
I don't want to overload you with information. And I will pause this. Will go, yeah, I will go over our homework that you will have to do. So for the homework, I don't want you to focus more on the aspect when it comes to the method, but I want you to
Mhm.
focus on refining the second paragraph and drafting the third paragraph. So in your third paragraph, the limitations have to include the limitation of the current technology. When I say
Mhm.
technology, it can be questionnaire, it can be visual assessment. When you say taking photo, right? Think about how that photo is taken and stored. Is it stored or not in the first place?
Okay.
So that is something that you need to, address.
Mhm.
Make sense? So that would be your assignment.
Okay.
So introduction, refining. So you have a lot of work with the second paragraph and also drafting the third paragraph. So you'll have to show that to me next time. We'll go
Mhm.
over it and then we will, ideally next week, we should have completed introduction.
Mhm.
The reason why we're completing introduction is because our methodology is finalized
Mhm.
and we know what to expect. Make sense? And
Yeah.
then I'll go over quickly the results and the pictures that we are going to choose for this case.
Okay.
Okay, that would be next time. But anyways, nice chatting with you. I hope you learned well. And then what feedback would you have for today's thing so that I
Um,
could improve?
yeah, I don't have any feedback. Today's session went very well.
Mhm.
I took like a good amount of notes, very informative. Um, yeah, I thought today went very well. So
Okay.
no negative feedback.
When you say well, like what would you say? What are the one or two things that went well for
Mm,
you?
uh, I think overall it was just like what we went over. I just felt like I understood it like very, very well. It wasn't hard at all.